Hi everyone, Dan Smith here from Sports and Spinal Physio. Today I'm going to talk about shoulder impingement. It is a super common condition and accounts for about 80% of the shoulder problems that we see in the clinic. So if you're struggling with pain in your shoulder when you put your coat on, your jumper on, when you reach for your seat belt, when you turn on your shoulder at night, or when you reach up into the cupboard, or maybe after a gym workout, then this video is for you. Make sure you watch to the end because I've got some additional help that you will want to know about. So here's the problem, let me explain. Problem number one. So with shoulder impingement, when you move your arm into certain positions, you might get a sharp pain or a twinge or a feeling of tightness in it. This is likely due to your arm and shoulder blade not moving as coordinated as they should and catching and impinging the tendons and soft tissue under here. This catching and impinging results in swelling and inflammation of the tendons and soft tissue, which results in them thickening and the tendon becoming more likely to catch again. So you can see how this is a self-perpetuating issue. Problem number two, sometimes not all movement hurts. For example, you might only feel the pain around the 90-degree mark as you reach out or upwards. We call this a painful arc, meaning that there is an arc of pain that clears once you go past it, but recurs as you come back through it. If this continues to happen, you can imagine that the tendon is going to get very unhappy. It brings a true sense to being rubbed up the wrong way. Problem number three. Sometimes impingement can make sleeping difficult, as laying on your shoulder and turning over brings the pain on. When you're relaxed in bed, you're not aware of your arm's position and you may inadvertently put your arm into a position it doesn't like. Additionally, inflammatory chemicals can seep out of the inflamed tendon at night while you lay motionless. This can cause increased pain at night, waking you up frequently. Now, if you can relate to any of these, please comment me and I will come back to you personally. So, what can we do about shoulder impingement? Right now, I'm going to share with you the two most common mistakes people make trying to treat this problem, as well as a simple to do at home exercise. Firstly, I want to share with you what you shouldn't be doing. Please don't waste your time on old-fashioned treatments like ultrasound, TENS and laser. These do not fix the problem and will only give you short-term relief. This is because they don't change the underlying mechanics of the problem. Now, the medical research tells us that most shoulder impingements are caused through faulty shoulder blade and upper arm movement, which is as a result of weak muscles or tight muscles around the shoulder. Therefore, this is what we must address. We come across patients who are trying to fix the underlying cause of the problem using TheraBands or weights, but are only working their shoulder muscles in one or two positions, such as down here rather than up here where they need to be worked. Shoulders work in multiple directions, therefore exercise drills must account for this and do the same. Making sure the shoulder blade is positioned and moving correctly is one of the first things to get right when rehabilitating a shoulder impingement. Think of the blade as the base on which the shoulder movements occur. If the blade is moving out of sync with the arm, the tendons will continue to get caught and swell up. Try the following. Gently squeeze your shoulder blades together. Keep your chest proud and then try lifting your arm up in front. See if the pain is any easier. If it's not, try lifting your shoulder slightly up at the front and then lift the arm up and see if this is any easier. These cheats might not help everyone, but if they do, then your shoulder blade is definitely contributing to your symptoms. Thanks for listening so far. Remember to comment me if you'd like one of us to come back to you. Alternatively, click the link below for some extra advice. I've been a physio for 20 years and I've seen thousands of patients suffering with shoulder impingement. One of my clients recently was struggling to reach up to the shelf to get the cat food down due to her shoulder impingement. This had been going on for nearly 6 months. Now, before she came to see me, she'd seen another clinician and had tried some acupuncture, some ultrasound and a fair bit of massage treatment. She found some temporary relief from her pain, but only for a few hours. Suffice to say, as soon as it was the cat's dinner time, the pain was back. When she booked an appointment with me, the first thing I did was to look at how her shoulder blade moved in coordination with the arm movement, and that's where we found the cause of her pain. Now, after 6 weeks, she was 70% improved and nearly completely pain-free come dinner time for the cat. She was back to doing her yoga, which she had previously stopped due to pain, although she knew more strengthening was required to get completely pain-free. Now, if you are thinking, can't I just have an operation? Well, statistics show that not all impingements can be resolved with surgery, and strengthening around the shoulder blade can bring about the same results, if not better, over a 12-month period. In fact, many patients that undergo surgery still need to work around their shoulder blade and their upper arm to fix the problem. So I said at the beginning of this video, I had some extra help for you. If you click the link below, you can download our Feeling the Pinch guide. It discusses more about the condition, the causes, the fix, and the steps you can take to preventing shoulder impingement returning. In addition, there are exercises included in the guide that you can start to do straight away. Now, if you download the guide, you will also receive a special offer, so look out for this too. I hope you got something out of this today. If you feel someone you know would get something from this too, please share or tag them in this post, because potentially we can help them. My name's Dan Smith. Have a great day. Thanks for listening.